Hello, and welcome to Do I Have a Choice? Shared Decision Making at Critical Points in a Long Illness Journey. This is our fall, NPF's fall 2023 policy consortium. And in this policy consortium, we really focus on not just the choices that we make, which is one of the things we talk about so often when we talk about shared decision making, but also the choices that we have. And in this policy consortium, we're going to look at and see videos and meet people from a year-long project that we did on shared decision making, and on where we had access issues, where people did not feel like they had a choice that they were able to make, where people felt like they had choices that they looking at how people were being able to make choices with their healthcare providers. So we began this project with the values and the principles that underpin all of our work at National Patient Advocate Foundation: learning from communities, not about communities; building and sustaining partnerships, but partnerships that we were invited into, not partnerships that we went into a community for. We really let them be directed by the partnerships. And co-creation. Co-creation is one of the principles that drives everything that we do. We co-create everything with partners in communities, across the country, and with individuals and also healthcare providers. And all of this was through the foundational value of health equity. So health equity and equitable access to affordable quality care is the underpinning value of everything we do at National Patient Advocate Foundation and everything we do at Patient Advocate Foundation. So thank you for joining us. We look forward to a wonderful consortium, and we look forward to introducing you to a lot of the people that we've met along the way. So this past year, we had the great opportunity and privilege of co-creating 3 workshops with our partners in the Mississippi Delta, Los Angeles, California, and Richmond, Virginia. So I wanted to say a special thank you to our partners, Ms. Viviana Criando at the Los Angeles Alliance for Community Health and Aging, Ms. Freddie White Johnson at the Fannie Lou Hamer Cancer Foundation in the Mississippi Delta, and Dr. Robert Gwen at VCU Massey Comprehensive Cancer Center in Richmond, Virginia. I'd also like to say a special thank you to Dr. Reggie Tucker-Seeley. So before we begin, I'd like to go through our agenda and just tell you what you can expect today. We're going to start with a session on advances in cancer treatment and the ongoing struggle for healthcare equity. And this was one of the themes throughout this project of Do I Have a Choice? And shared decision making. That presentation will be, our speaker is Dr. Robert Gwen. Then following that, we have a panel discussion that also talks about advances in cancer treatment and ongoing struggle for healthcare equity. That panel is moderated by Ashley Freeman, and we're going to have three panelists that are from the 3 different places that we were in our workshops: Tamarin Collins from Mississippi, George Trung from Los Angeles, and Sharon Rivera Sanchez from Richmond. The next session is going to be a multimedia presentation about shared decision making while living with cancer and other chronic diseases. And this is really where we will show you, we'll talk with you about learning from the community and what we learned through these 3 workshops. We also have video and photography presentations featuring people that we met along the way. Following that, we're going to have an interactive and lively graphic medicine session, which is called Drawing Our Way to Collaborative Care. And I really encourage you to participate in that workshop. It's going to be interactive using the chat. And that workshop will be led by M.K. Serwick, who is the founder of Comic Nurse. And finally, we have a conversation between Dr. Reggie Tucker-Seeley and Dr. Stanley Frencher about overcoming barriers to quality care. So next slide, please. I'd like to to thank the Danaher Foundation, who supported this project and allowed us to do this year-long project on patient-centered care and shared decision-making at critical points in the long illness journey. This project comprises workshops. There'll be there will be advocacy curriculum training modules. We're doing a podcast series, and you'll hear one of the outros of the podcast series, and a number of other things. So the workshops are really the centerpiece. It's what we learned, and it's how we built all of this, and we learned for this, and we would not have been able to do this without the support of the Danaher Foundation. Next slide, please. And I'd also like to thank our policy consortium members who have supported this consortium, for many of them, for many, many years. So thank you to our consortium members. I'd like to also give a special thank you to our team who worked on this project: Ashley Freeman, Chris Wilson, and Jamie Trotter. They worked incredibly hard on this project. We did a lot in it. Actually, the year isn't quite over, but we did a lot. We traveled widely, and we learned so much from our partners in the places that we went. So I want to, before I turn it over and introduce Rob Gwen, I want to encourage you to participate in the chat throughout our policy consortium. Make comments, make observations. It's always, the discussion in the chat is always very rich, and it makes the policy, it gives another dimension to the policy consortium. So please comment, have conversations, and participate in the chat. So I would like to, next slide, please. I would like to introduce my my friend and colleague, Dr. Robert Wynn. Dr. Wynn and I have been doing many things throughout, making trouble throughout the country. And he's a very close friend and partner of the National Patient Advocate Foundation and the Patient Advocate Foundation. Dr. Wynn is the director of the VCU Massey Comprehensive Cancer Center. And he's going to talk to us on advances in cancer treatment and the ongoing struggle for health equity. Thank you.